been one of the hot topics of the year. I know that there's been a lot of interest in the certificate of need process and its impact on, as particularly on smaller hospitals in rural areas. And I think there's been a lot of interest specifically in this task force. So it's my understanding that not all of the appointments to the task force have been made. I'm hopeful that we'll be able to get all of those remaining appointments filled, but I'm grateful for all of you for lending us your time, your varying expertise. There are a lot of great people who are represented here today, and I'm hopeful that we'll be able to make something of it. I've been warned by past people who've gone in depth into the CO1 process that this is one of the great mistakes that any legislator or any committee could ever do, is try to wrestle with CON reform. I know that there have been past efforts at reform that have not gone anywhere. And perhaps we could look to that as through the process to see what ideas have been proposed previously, and if we can learn from them. But with a possible with our eyes fully open to what we're getting ourselves into, I'm excited to open the conversation and excited to co-chair this task force with Representative Wood.
Great, thank you, Senator. And at this point, we could just go around, and I'll just leave it up to everyone to kind of just wave your hand and introduce yourself. In addition to introducing yourself, maybe in a few sentences, just let us know what you're hoping to see come out of this task force as some goals, and we will have Alex keep track of that. And we can start right now. I'll just kick it off. Why don't we start with Rose McGovern?
Okay. Hi, everyone. I'm Rose McGovern. I'm from the Attorney General's office. I am in the Health and Education Department. I represent OHS in any appeal that is filed or action that could be brought against them in Superior Court. And I also provide review of their decisions for legal sufficiency when it's requested. I don't have any goals as far as the task force is concerned. I'm here to, provide assistance, particularly related to the different statutes that are at play. And, I'm happy to be here and provide assistance in any way that I can.
Thanks, Rose. John Brady.
Yeah, thank you, Representative Wood. My name is John Brady. I am a registered nurse. I'm retired from the bedside, but I am the vice president of AFT Connecticut. Our members, staff of many of the acute care hospitals in the state, and the assistant attorney generals also. What I'm hoping this task force can do is address some of the problems that we've identified, especially as Senator Lesser said, around the decrease in services in rural hospitals in Connecticut, especially in labor and delivery, which has been a big issue in so many of our places, like at the Windham Hospital in Sharon and other places. So I'm hoping we can find a way to deal with that, and maybe give either OHS or the Attorney General's office the power they need to enforce what I think is the spirit of the certificate of need law and process.
Thanks for that, John. Dan Keenan, sorry, Keenan.
Good afternoon, and appreciate the opportunity to be with everyone. I'm Dan Keenan, serve as Vice President for Advocacy and Government Relations for Trinity Health of New England, which includes St. Mary's Hospital in Waterbury, St. Francis and Mount Sinai Hospital in Hartford, Johnson Memorial in Stafford Springs, and a network of ambulatory care and physician practices. And I've, along with government relations, I do quite a bit of work with the regulatory space. So really appreciate the opportunity to work with all of you to try to improve the certificate of need framework and process. And I think, big picture, my goals are to try to have an impact on this from an access to care perspective and affordability perspective, in how the CON process can promote an appropriately competitive healthcare system in Connecticut to best serve the needs of communities and patients. So thanks again.
Thanks, Dan. Nancy Heaton.
Hi, I'm Nancy Heaton. I'm the CEO at the Foundation for Community Health. I'm located in Sharon, Connecticut, and we were the first health conversion foundation that resulted from the conversion of Sharon Hospital to a for-profit. As many of you know, that has now been converted back to a nonprofit hospital. But as such, I've been witness to several of these hospital conversion CON processes. I've participated in a few. We even helped purchase the hospital to become more a nonprofit. And so I just have an interest as a representative of the rural area also in understanding better how we can better balance the role of the state government to ensure that people have access to a full variety of resources in our throughout the state, while balancing currently the fact is that these nonprofit hospitals and for-profit hospitals are really determining where services are being done. And so is there something that can happen between the two of them that can really make sure that everyone has access to the services, particularly those services that are offered to people the states are responsible for, like people on Medicaid and people have limited resources. So thank you.
Thanks, Nancy. Susan Lagarde, is that how I say your last name?
You got the last name right. A little bit on the first name, it's Suzanne, but that's fine. Sue will do. Thank you. I am Sue Lagarde. I'm the CEO at Fairhaven Community Healthcare, a federally qualified health center in New Haven, Connecticut. We care for over 32,000 individuals annually. My goal in this is to ensure the voice of the marginalized communities that we serve in the CON process. My goal would be to hopefully not only ensure that they are not harmed by any of these processes. I would argue that they should potentially benefit from them. So yeah, that's me. Thank you.
Thanks, Sue. And I believe the remainder of the people on the call are with OHS and the Department of Insurance. Is that correct?
Yes.
Great. So I wanted to move to the next point on the agenda, which is a review of Public Act number 22-118. That relating to certificate of need, we had increased the fees, and we had also defined the word termination. I wanted to pass it over to OHS to give us an overview. I'm not sure if that went into effect immediately or if that's like an October 1st. If you could just give us an overview on when that goes into effect, if there's been any changes, and then if you could just fill us in on other things that are happening in this space. We've all heard from constituents of ours and others around the state on approving and not approving, and perhaps you could just give us a report on this Public Act and some of the latest issues dealing with CON.
Hi, Representative Wood. This is Kimberly Martone. I'm the new acting executive director of OHS. And I have with me Laura Manzione, who is our health systems planning manager, and Stephen Lazarus, who is our certificate of needs supervisor. So I'm actually going to defer to them because I do know that both of them were instrumental in putting forth implementing the fee structure, which is still in progress in terms of we have a short-term and long-term goal, as well as the definition of termination. Laura?
Thank you. Good afternoon, everyone. Thank you for having this committee. This is very important work, and I appreciate you putting it together. That Public Act that you mentioned, 22-118, does implement a new fee scale. Prior to this Act's implementation, which was effective on passage, and I believe the effective date was May 18th or 19th of this year. Prior to this implementation, the filing fee for any organization or entity that was filing for a CON application was $500. So no matter whether the value of the transaction was $0, $100, $1,000, $1 million, the filing fee was always $500. What the legislature did this past session is implement a fee scale. So the exact numbers are on our website, but basically anything under the value of $50,000 will incur the smallest amount of fee, which is $1,000. So just for comparison, it used to be $500 across the board. Now the smallest number is $1,000, and then it goes incrementally up by $1,000 or $2,000 all the way up to $10,000, and that's for in excess of, I believe it's 5 million. So that's how this fee scale works. It was effective on passage. We are in the process of still implementing it. Our computer systems and our payment system was not set up in order to accept a range of payments. We were piggybacking off a payment system that the Department of Public Health has set up. So we are working on getting our own payment system. We're working with OPM, but in the interim, what we're doing is we're collecting that initial $500 deposit as our system is set up and invoicing for the excess fee. We expect that all to go through. I'm not exactly sure whenever OPM and we work it out. The second point was about the definition of determination. This has to do with when a service that a hospital, specifically a hospital, offers on an inpatient or outpatient basis, when a cessation or suspension of that service actually is terminated. There had not been a definition in the past, and now we have defined, the legislature has defined the one after a hospital determines that 180 days have passed, we will consider that a termination. So once they announce it's suspended or stopping or ceasing for whatever reason, after 180 days, it will be considered terminated. So Steve, anything I missed out on the fees especially?
No, I think you covered everything. As far as the fees go, I will add one other thing is that we are in the process of revising before we even get the new system in place. And hopefully we should have up and running within a week. So we should be able to collect all the fees without even invoicing in a matter of about a week.
Thank you both.
Great.
I guess we'll just, if anyone has questions, just raise your hand. I'll start with a few questions if you don't mind. The fees, one of the reasons why I think all of us that were interested in raising the fees proposed that was we kept on hearing that there were staffing shortages at OHS to make sure that the CON process could be less time consuming. How has there been any new hires? I know that there were, I think, 3 or 4 allocated in the budget. Plus we have these fees increased. Can you give us an update on hiring and, streamlining of the CON review process?
I'll answer at least the first part. Representative, in terms of the hiring process, the fees that are being generated go back to the general fund. So they do not, directly go to OHS for resources. However, you're right, with the budget, we were able to hire 3 additional people. So right now they were just posted this week. So there's 2 analysts and a paralegal. So we're hoping to have somebody in over the next couple months, I'll say. And then in terms of streamlining the process, can you give me more information about what you're looking for?
Some of the during our discussions and working on this CON language, we were hearing from members of the public that had gone through the process that their comments back to us, and not everyone, but some of the comments were that the process is very time consuming. So I assume that if the hires haven't been implemented yet, you really can't answer that question at this time. So we can talk about that in the future. But I know that's a goal of OHS and a goal of, I think, all of us that worked on this language. So we can certainly talk about that in the future.
Yes, and we are also hiring an agency legal director who will oversee our legal office, which includes certificate of need. And we also have a new staff attorney who will be partly a hearing officer who will be starting this Friday. So I think we will see something to get back to you in the fall.
Great. And then my second question is related to the defining of termination of services and kicking off the CON process. Has this happened since this language has been implemented?
Laura, could you address that?
Certainly. That definition went into effect on passage, as I said, was around May 18th or 19th. And so we are tracking services when we know that they have been announced as being ceased or suspended. We have not yet reached 6 months or 180 days in any of the services that we know about that are have been suspended. So we have a tracking system for the hospitals that are doing this that we know about. So no one has actually reached the 180 days. So we
Okay.
haven't gotten there yet.
Okay.
May plus 6 months is November.
Okay, so we can get a report on that in the future. Anyone have any other questions for OHS?
Representative Wood, this is Dan Keenan, and this is more of a general question, and it's, the path that you went down regarding adequate resources, and just kind of ask, based on the kind of current frameworks, that there are several new potential staff members who are going to be coming on board with the expertise to try to help. Do you think that that is, the appropriate level of staffing based on historical caseloads in order to kind of move projects or initiatives through the framework efficiently, or do you think there's significantly more resources needed in order to accomplish that? And I guess part of that question would be like, how, what does that mean efficiently through the process? But just any comments that you have on that would be appreciated.
Are you asking me, Dan?
Yeah.
Okay.
Yep, Kim, that'd be
Just
great.
making sure. Okay.
Yeah.
In response to your question, my one area of concern continues to be our compliance end. So I do feel that we will need additional resources to strengthen our enforcement, not just our enforcement authority, which needs to be strengthened, but as well as our compliance, and are looking at the conditions, making sure that the providers are in compliance. We have independent monitors sometimes. I don't think that's exactly the strength that we want to have in the CON program. So we, Laura and Steve and myself are going to be looking at that and trying to crunch some numbers for all of you to get at how many we would need to make sure that the compliance end of the CON process is just as strong as the process itself.
Thank you.
Welcome.
Anyone else?
Yeah, I have one, Representative. Kim, about the, maybe I'm getting too much into the weeds too quickly here, but about the enforcement authority, I guess it's a general question, whether you have a feeling already about whether OHS should have that power, the Attorney General's office, some kind of a combination. I know it's done different ways in different states.
Mm-hmm. Honestly, my opinion is it should be in combination with the Attorney General's office. And that is from looking at other states' experience over the years.
That could be helpful for us as a task force going forward, then knowing that, and maybe like knowing which states you see as best practices on that too.
Mm-hmm.
Thank you.
We can definitely look into that. You're welcome.
Yeah, Representative Wood, I just had a follow-up, and I apologize, I got admitted late. I'm not going to take it personally, but I was held in the waiting room for a while.
Oh, so sorry to hear. If you want, Patrick, if you want to just give an introduction and introduce yourself to everyone too, that'd be great.
Yeah, hello. Sorry again for being a little late. I'm Pat Charmel. I'm the president and CEO of Griffin Hospital and Griffin Health, its parent company. For those of you who know, Griffin is an independent community hospital based in Derby. I just wanted to follow up with Kim. She had mentioned that she needed some additional resources for enforcement, but I know for a time there was a problem with not having enough staff just to process CONs that led to pretty significant delays, which was a source of dissatisfaction for applicants. I just didn't know what the current status of that. Have you been able to fill some of those positions and now feel that you have what you need, or can we advocate for more resources?
We are going to be filling probably over the next couple months, 2 analyst positions and a paralegal and an agency legal director and another staff attorney. So we have a staff attorney starting on Friday. So we'll be able to tell you in the fall if those resources are adequate. But compliance, no. The CON process, I'm going to say probably.
Wow, that's great.
Yeah.
And those are going to be all favorable decisions that you render going forward with the additional staff?
That's very funny.
It will be favorable to someone. I
Thanks,
can guarantee that.
Well, that's great. I mean, I don't think you've been in that position for a long, long time, right? To have that level of resources available?
No, we've asked for many, many years. And it's the first time that it's been recognized and very much appreciated. So I think we'll be in a good place. I do.
Fantastic.
Representative Pat Lactamano, you also just newly joined us. Do you have any questions for OHS?
Initially, yeah, just one. Thank you, everybody, for coming. You talked about the payment, at least when I jumped in, the tiers of payments. And I think that it was going to be taking any computer adjustments, I guess, were going to be taken care of in about a week. But how are you finding that as far as implementation goes? And do you expect, I'm not really looking for an increase of revenue, but I'm wondering if there would be an increase of revenue. And number two, if you find that, I don't know, maybe in application it is or isn't working out. I was just wondering your general take on that part of the bill.
Eva, I'm not sure if you've had a chance to look at it. Have you? Because if not, we can get back to the committee.
On what part?
On the first part, I don't know if we've actually looked at it,
Oh,
you know,
okay,
if
okay.
there's going to be an increase in fees. I mean, we could go back and look at past applications and kind of, you know, make an estimate about the actual increase. But I don't know if Steve, if you've looked at it.
We haven't done an in-depth study, but you know, it depends on the cost of the project that comes in. What we can do is we can just, like you mentioned, we can do a study over the past year, the types of applications that have come in and what their cost is, and we can estimate. But again, moving forward, you know, projects change, different types of project. So, but yeah, we can certainly do a study and provide a copy to this committee.
Yeah, I think because initially when we were going through, I thought we found, Carrie, some exceptions for some certain equipment. And so I think our concern was that we didn't want to hurt, you know, some small offices or, you know, small practices that are trying to obtain new and the latest equipment. So, you know, I wasn't sure how that was panning out and, you know, if there were complaints by anyone or if you think it was hurting or helping, you know, our breakdown.
So because these fees are set up on a scale, depending on how much they cost, so there would be something different that would come in. And again, I think we'd have to go back and look and see what the cost of the equipment would be. Many times the cost is not as high because they may be buying existing equipment that's in the market versus acquiring a new one, which are actually not as many as you would think coming in additionally. We don't have that many of those applications, but we do have those. But again, we'd have to go back and look so we can give you a better idea. I hate to guess and tell you something that may be off a little bit.
So is it your interpretation? Sorry, just one more.
Oh, that's
Is it your
okay.
interpretation that it's new to that practice or a new piece of equipment?
No, it depends on the cost of the equipment. It would cost of the CON that's coming in. So the cost would be whether it's in say, so the way the CON fees are structured, you know, they range from $1,000 to $10,000. And it depends on how much each CON would cost, what would be based off.
Right, but you had just mentioned a piece of new equipment. So, but if a practice acquires a new piece of equipment to that, it's new to them, even if it's a used piece.
No, I meant as far as the cost of a brand new piece of equipment. For example, if you look at an MRI,
I
brand
see.
new MRI would may cost
Okay,
a couple of $1 million versus used
Gotcha.
one may not because it's already been depreciated.
understood. Okay, get it. Thank you very much. That's all.
Great.
That's all.
All right, so I think we can move on to our next point on the agenda, which is discussion of our goals and how the task force is going to operate. This is an introduction meeting. There are still positions to be filled, as Senator Lesser said. There are people that reached out to me that could not make this. So what we'll do going forward is Alex will plan, we'll plan like the next 3 or 4 meetings and get some dates out there and have everyone chime in on dates that work best. I mean, it's not always going to work for everyone, but we want to make sure that we are as accommodating as possible. We can even do in person one of those meetings if that would be good for everyone, maybe at OHS even. Again, we'll just put it out there and have that, discussion over email. We do want this to be as transparent as possible. So, having the public participate, we didn't have the ability to do that with this meeting, but for future ones, we could have the public participate. Maybe there are people that are not members of the task force that just want to come on and give us their feedback. So those are some things we can do. But regarding goals, I'd love to set some goals maybe today, and we can always add to it going forward. I did hear some of the things I heard are concerns for decrease of services in rural areas. I don't know if everyone is on consensus of that. I'll just throw a few things out and then we'll open it up for discussion. I did hear access to care and affordability, which, the affordability part, for me personally, I think is a really big concern. So I'd love to try to have us tackle that. And maybe what we could do is split out into working groups as well. I did hear, making sure the marginalized community is, has a voice in this process. I'll just pass it over. I'll see Senator Lesser has his hand raised, but I'd love to have a discussion of what the goals could be. And then we can set those and kind of break them out and form some working groups. Senator Lesser?
Thank you, Representative. I would just start I agree with everything you said. Particularly, I think it's important that we at these meetings solicit feedback from the public. I think that's a good way to make sure that we're on task and that we're answering concerns. I know this is a potentially exhaustive field because there's all sorts of different which ways we could go on CON reform. But I would like to start with just emphasizing the language of Section 124 that set up the task force, because there are 10 questions that the legislature asked us to look at, and I think we should start with those and then use those to sort of center what we're working on. And if we get pulled in one direction or another, then that's okay. But I think we should start with those. And I'll try to go over them briefly. But the questions are studying and making recommendations concerning the following matters: the institution of a price increase cap that is tied to the cost growth benchmark for consolidations. 2, guaranteed local representation of communities on hospital boards. 3, changes to the Office of Health Strategies long-term statewide health plan to include an analysis of services and facilities and the impact of such services and facilities on equity and underserved populations. 4, setting standards for measuring quality as a result of a consolidation. 5, and enacting higher penalties for non-compliance and increasing the staff need for enforcement. 6, the Attorney General's authority to stop activities as the result of a certificate of need, application, or complaint. 7, the ability of representatives of the workforce and the community to intervene or appeal decisions. 8, giving the Office of Health Strategy the authority to require an ongoing investment to address community needs. 9, capturing lost property taxes from hospitals that have converted to nonprofit entities. And 10, the timeliness of decisions or approvals relating to the certificate of need process and relief available through such process. So, there's a lot there. I'm sure there are members who have feelings just about the language of that, and I don't want to prejudge anything or say that we have to do all of those things, but I think we should at least start sort of by looking at those in turn and see if we have thoughts and solicit input on those. And I think that would be helpful. And then the other thing I would suggest, and I mentioned this earlier, is There have been past task forces that have looked at CON reform. I believe there was one in 2015. Does that sound right? It would be helpful to see what those recommendations are, see, why they weren't adopted, see if there's anything worth dusting off the shelf. I think that might be instructive. Obviously, the big thing that's hanging over us is consolidation. And we've seen a very different healthcare landscape in recent years and a much more consolidated market. And I think that informs some of the questions that the legislature asked us to answer.
Excellent. I think as a next step, we can copy those into an email to the entire committee, and we can start to, I think, maybe bundle maybe 2 or 3 of those into a group, and then we can form working groups so that we can come to the future meetings with a little bit of data and support into how we can, address those goals that were given. I think hearing those again, a lot of what the concerns were from people on the call, I think fall under, one of those points. So that will be our guide going forward. Anyone have questions? Suzanne?
I'd just like to request, would it be possible for us to get copies of that 2015 or whatever year recommendation of the last task force?
Sure, we'll send out a copy of the recommendations from that task force. We'll include the direction from the language that was given in the 2022 session. And if there's any other information that we have supporting any previous work that was done, we'll make sure to include links or attachments. Okay, so that's what we'll do going forward. We will send out an email to everyone with a bunch of dates so that we can kind of set meetings now through the end of the year. We will fully, appoint the task force, and we will ask people to break it up into some working groups, and then kind of have some action items that we can come to future meetings with, which again will be open to the public. Anything else that I'm forgetting? Okay, thank you for our first meeting. And at this point, we will adjourn, and I look forward to working with everyone on a lot that we have going on, but I think it's going to be really good work. And this way we can head into future sessions ready to go.
Thank you.
Thank you.